very welcome back. Now, yesterday new figures emerged which found that thousands of children have not been receiving dental screenings throughout much of their primary school education due to a reported shortage of HSE dentists.
The amount of messages we got in from you about this yesterday, about kids not getting them all, some of them not getting them until they were in 5th and 6th year. This is a primary school appointment. Joining us now to discuss that story is Dr. Caroline Robbins from the Irish Dental Association. Caroline, thank you so much. From an Irish Dental Association point of view, were you surprised by this report that people are not getting their checkups in primary school?
No, because backtrack to April 2024, this was front page on the Irish Independent as well. 100,000 children, 1,000 kids missed their screening, and that was over a year ago, and here we are, 2025, talking about the same thing.
Why? Why is this happening?
Well, we simply just don't have... From the school side point of view, the number of dentists that are employed within the HSE school screening service has decreased. I think, you have the numbers there. It's decreased from about 330 down to around the 250 mark. I mean, that's an exponential decrease in the number of physical hands to do the screening. The population has exponentially increased. And you've got this, this gap. So, and then you throw in a little dose of COVID and then the catch up on that. And they're struggling. So once upon a time, the school screening system, which, by the way, when funded and resourced beautifully, it's a really good system.
Works well, yeah.
It really works well. It targets, ideally, kids in 2nd, 4th and 6th class of primary school, kind of coincides with important developmental stages of growth and teeth coming into the mouth. Unfortunately now, a lot of it is, emergency-only basis and then having to prioritise the different age groups, which, of course, at the moment is 6th class. And as you've rightly said, there are kids being seen in TY and 5th year. Anecdotally, I heard a dentist say that one of the patients arrived, they drove themselves.
Yeah, we got a lot of it yesterday morning. We were saying that because like that, you were saying 2nd, 4th and 6th class, and then the 6th class was then being prioritised if you haven't had any at all. And that 6th class appointment might not be happening until you're in... and then we people in college, people that
might get them in college, their braces.
They were much older. We're looking at, particularly, you mentioned the numbers of dentists that are leaving the HSE system.
They're not so much leaving the HSE system, they just were never replaced. So a combination of when dentists retired or perhaps left for other reasons, and then add a dose of the embargo, and they haven't been replaced. So we have now decreased numbers of existing dentists still in the system, having to look after a much larger cohort of children. So the math doesn't work. And
what is the situation with actually training dentists in Ireland? Because I know that's something that the Irish Dental Association are highly focused on.
Yeah, so we've talked about population. I'm here 25 years. I came to this lovely island of Ireland in 1999, and I had a look at the census for the year 2000. I think 3.8 million was the population. What are we now sitting at 5.3? The number of training places has not increased until this year. Now, the Royal College of Surgeons is opening a new training school that will take its first intake in September, which is a very welcome thing. However, what we find and what you will find when you look really closely at it, there is a real reliance on the universities, on international students. So they are paying obviously much higher fees to help balance the books. That's across a lot of, it's worldwide. And so we have a lot of Canadian or maybe Middle Eastern students come in. And then when they finish, I mean, A, they go home, but B, they can't actually stay here because they can't just start working. They're not stay because of the visas.
They're on a student visa, that's it. 0896 111 111. I know we spoke about this yesterday, but we'd love to hear from you on this because, as you mentioned, the Royal College of Surgeons, those dentists are coming on stream for, what, 5 years?
5 years.
5 years is what they're going to do. So why, when you're talking about dentistry, the course, it's so high, it's over 650 points because there's so few places.
Yeah.
Why didn't they increase places ages ago?
It's a hard one because dentistry it's very bespoke. You need to train a dental student, you need a dental chair. It's not like we can simply add 2 more rows into a lecture theatre and we've got more people doing this degree. You need the infrastructure, and that is part of the problem. For example, Cork Dental Hospital in 2019, Simon Harris turned the sod for a lovely new dental school on a green site. And then COVID hit, and now that's been shelved because it's become cost prohibitive.
We got so many. Can I go into the same in just a second? Could you just tell us what's happening to kids? We were talking about just rotting teeth not being caught.
Kids are just missing all their basic dental screening. I'll give an example. Second class is probably it's like the golden stage of wanting to get the kids in. It's around 8 years of age. And it coincides with a time between 6 and 8 when your first adult molars come in. We call them your 6-year-old molars. Now, they can come in and adult teeth come in with very little fanfare. Like most parents out there will be able to tell you every single baby tooth that came in.
Yeah.
They'll remember a rosy cheek or a fever or a crankiness, and they can tell you when it was. Whereas these adult teeth just arrive in unknown, and there's a condition called MIH. It's called molar incisor hypomineralization. What does that mean, Caroline? It means brittle enamel. So it affects often these first molars, and because the enamel's brittle, when you chew on them, they break down through no fault of the child. It's just the architecture of the tooth didn't form properly. And then the shock of parents when I turn around and say to them when they come into me, I'm like, I'm really sorry, your child has 1, 2, 3, up to possibly 4, almost sometimes destroyed.
Oh my God, and this thing has to be caught early, I guess.
Yeah.
That if you don't catch it on time, you're going to be pushed.
0896 111 111 to get in contact. The HSE have sent us in a statement in 2024. The HSE's oral health care service provided care to over 156,000 adults and children. This includes almost 50,000 emergency appointments to eligible patients on a same day or next day basis. And then they go down to the second class list. They're trying to increase that all of the time. Dr. Caroline Robbins, Chair of the GP Committee of the Irish Dental Association, thank you so much for joining us.
Thank you so much.
Thank you so much.
Thanks.